Jay. I'm a psychiatrist, and a few months back, I had a patient who had been having nightmares for most nights of the week for 4 straight years. They had tried talk therapy, they had tried sleeping pills, they tried just about everything, but nothing had worked. Then they came to see us, and I explained how trauma actually gets stored in the brain and why the nightmares wouldn't stop without addressing that specific mechanism. Now, 8 weeks later, the nightmares were basically gone. You see, what a lot of folks don't realize about trauma treatment is the fact that the most effective approaches aren't just about talking through what happened. They're really about rewiring the fear circuits in your brain. And when we understand the neuroscience behind why these treatments work, well, we would not look at trauma and PTSD the same ever again. So let's break down 3 highly effective trauma treatments and the brain science that makes them. If you're new here, I'm Dr. J. I'm a medical doctor specializing in psychiatry, and my singular goal on this channel is to make mental health make sense for you. So, PTSD and trauma reactions happen because traumatic memories get processed differently in the brain than regular memories. You see, normal memories get filed away properly. You can recall them without your body freaking out. But traumatic memories often get stuck. They are fragmented. Think about it like little pieces kind of all over. And every time something reminds you of the trauma, your brain acts like the danger is happening right now. Your heart races, you might start sweating. This is called hyperarousal. And your body basically goes into fight or flight mode even though you're actually safe. So effective trauma treatment has to address this stock processing, and that's exactly what these 3 approaches do. Our very first treatment is prolonged exposure therapy. Now, for simplicity, let's just call it PE. And here's how it works. Under the guidance of a trained therapist, a client gradually and repeatedly revisits the traumatic memory in a safe and controlled way. This might mean talking through what happened in detail multiple times, or it might mean gradually approaching situations they've been trying to avoid because it reminds them of the trauma. I know, it sounds terrifying. Why would anyone want to relive the worst moments of their lives over and over again? Well, here's why. The brain has a structure called the amygdala. Think of this as the fear and alarm system of the brain. After trauma, that alarm gets way too sensitive. So things that remind someone of even the slightest of their trauma sets it off. A car backfiring might trigger a combat veteran, or a crowded space might trigger someone who was assaulted. Now, what PE does is retrain that amygdala through something called fear extinction. And that's when a client revisits the memory, but this time they're safe. Nothing bad happens, and your body starts to learn, wait, I think I can talk about this and be okay. I'm not in danger right now. Now, over time, and this takes multiple sessions, the fear response starts to decrease. The memory is still there, but it doesn't hijack the nervous system anymore. Let me walk you through what this looks like. Think about someone named Bob who survived a serious car accident. Now, Bob can't drive. Even sitting in a car makes Bob's heart race. With PE, they might start by just sitting in a parked car for a few minutes, just sitting. Then maybe they sit in a driver's seat. Then they start the engine, but don't go anywhere. And they drive around the block. You see, with each step, their brain is learning, okay, I'm safe. This isn't an accident happening all over again. The neuroscience here is super important because every time you approach a first situation and nothing bad happens, you're building a new neural pathway. You're teaching your prefrontal cortex, which is the rational part of the brain, to communicate better with your amygdala, basically saying, hey, calm down, we're safe. And research shows that PE reduces PTSD symptoms in about 60 to 80% of people who complete treatment. That is huge. Our second treatment is something called EMDR. Now, the name sounds complicated, but stick with me. EMDR means eye movement desensitization and reprocessing. On EMDR, you focus on a traumatic memory while simultaneously doing bilateral stimulation, which usually means following a therapist's hand back and forth with your eyes, or sometimes they use tapping sounds that alternate between your left and your right sides. And I know what you're thinking. How is moving my eyes back and forth going to treat trauma? Sounds like nonsense, but there's actually really fascinating neuroscience behind it. And that is when you're thinking about a traumatic memory and doing bilateral stimulation at the same time, you're actually taxing your working memory, and your brain can only hold so much information at once. So when you add eye movements, the memory becomes less vivid. It becomes less emotionally intense. It's kind of like you're turning down the volume on this memory. At the same time, this process helps the memory gets reprocessed and properly stored. Now, remember how I said traumatic memories are fragmented and stuck earlier? EMDR helps move them from that stuck place in your amygdala into your hippocampus, which is where long-term memories are properly filed. Now, once that happens, you can remember what occurred without your body reacting like it's happening right now. Take a second to think about someone who got into a fatal car crash. Every time they think about it, they feel the same type of terror, the same physical sensations, the same overwhelming fear. You see, with EMDR, they process that memory while doing the eye movements, and what happens to the memory starts to change. It becomes more like a regular memory, still unpleasant, but not quite as traumatizing. They might then be able to say something like, you know, that happened to me and it was horrible, but it's in the past. Research also shows that EMDR can significantly reduce PTSD symptoms in as few as 3 to 6 sessions for some people. Certainly not everyone, but for many people, it can work surprisingly fast. Our third treatment is medications, specifically SSRIs, which means selective serotonin reuptake inhibitors. Now, I want to be clear, medications don't necessarily cure PTSD, but they can significantly reduce symptoms and make it possible for someone to engage in therapy. Because here's the thing, if your nervous system is so activated that you can't even sit through a therapy sessions without panicking, then you most likely need something to bring down that baseline arousal. SSRIs like sertraline or paroxetine are the first-line medications for PTSD, and I'll describe how and why they work. You see, serotonin is a neurotransmitter that helps regulate mood, but it also plays a huge role in fear processing. After trauma, the brain's serotonin system often isn't working right, which can make fear responses exaggerated or can make one's ability to regulate emotions impaired. SSRIs basically increase the amount of serotonin available in your brain, and when you have more serotonin, a few things happen. 1. Your amygdala becomes less reactive. It's no longer firing off alarm signals as intensely as before. 2. Your prefrontal cortex, which is what helps you think rationally and regulate emotions, it starts to work better, so you're able to process difficult memories without becoming completely overwhelmed. There's also evidence that SSRIs also promote neuroplasticity, which is your brain's ability to form new connections. This is crucial for recovery because trauma treatment isn't just about reducing symptoms. It's really about building new and healthier neural pathways. For example, think about someone with PTSD named Bob. Bob is constantly hypervigilant. They startle at every noise and they cannot relax and they're exhausted all day long. When Bob starts an SSRI, and it usually takes about 4 to 6 weeks to really kick in, your baseline anxiety starts to come down. They're still working through trauma and therapy, but now they can actually sleep. They can focus, they can engage in therapeutic work without feeling like they're drowning. In my practice of psychiatry, the combination of medication and therapy is often more effective than either alone. And in this case, the medication helps stabilize the nervous system while the therapy helps rewire the fear memories. Okay, if you like this video, then you'd want to watch this video right here that breaks down the nuanced relationship between trauma and the nervous system. Also, be sure to subscribe so you do not miss out on future videos. I read and respond to every single comment, so join the conversation by dropping one thought that came to your mind as you're watching this video. I may just make a video responding to your thoughts in the comments. In the meantime, I'm Dr. J, and this has been Mental Wealth MD. I will see you in the next video. Take care.